to Message Zambia. My name is Dr. Mataa. I am an internal medicine physician, neurologist, and palliative care provider. I am also one of the co-founders of Message Zambia, which is Zambia's leading mobile health directory. Our intention as Message Zambia is to try to make healthcare simplified, making it easier for people needing health services to be connected to those providing health services. Today, we thought we would join the rest of the world as we come to the end of February in commemorating a very important topic. The 4th of February is commemorated worldwide as World Cancer Day. The theme for this year was I am and I will. As Zambia, across the country, many events were held to commemorate this event. On the 24th, there was a virtual launch of World and Childhood Cancer Day. So we thought we would have a discussion just to talk about what is cancer? What are some of the common cancers that we should all be aware of? What should we look for if we think that yourself or a loved one could possibly be living with cancer? How do we actually make a diagnosis of cancer? And can cancer be treated? So over the next few minutes, you and I are going to just chat, and I'll hopefully try to answer some of those questions. So I guess the first thing is, what is cancer? I think the simplest way to think about it is cancer is your body doing what it's not supposed to be doing. Our bodies are made up of millions upon billions of cells, each with a specific job. But sometimes those cells begin to grow abnormally, and they keep growing and keep growing, and then they spread to other parts of the body where they're not supposed to be. So cancer is your body growing parts of itself more than it should, and those parts going to other parts of the body where they no longer are doing what they're supposed to. They begin to cause you harm. That is basically what cancer is. What's the question in terms of what are the different types of cancers? There are over 100 million types of cancers. Any part of your body could potentially begin to grow abnormally. And once it starts doing that, then you have a cancer. But there are a few that most of us would probably have heard of. Most of us would probably have heard of breast cancer, cervical cancer, prostate cancer. These are some of the common cancers that even here in Zambia we do find. But there are a lot of different types of cancers. There are what we call leukemias, which are cancers specific to your blood cells. There are cancers that just affect your brain, where parts of your brain begins to grow abnormally. You can have cancers in your reproductive organs, in your ovaries. You can even have skin cancer. Even among darker skinned people like myself, it is still possible to develop a skin cancer. So it's very important to be mindful that any part of the body can be affected by a cancer, but there are some that are much more common than others. And these are the ones I'm really going to spend some time talking about today. So how does someone know that they have cancer? I think the first thing is your body will always tell you. We need to learn how to listen to our bodies. When we are in pain, when something that's not supposed to be there begins to show itself, that is your body telling you that this is wrong and you should have it checked out. Let's talk about breast cancer, for example. For most women, the first time they notice anything wrong is when they are taking a shower, taking a bath, and as they are bathing, they notice a lump something that wasn't there before. So that should be what we call a red flag, a warning sign. Because once something that wasn't there before is now there, that is something that should be looked for. For men, for example, after a certain age, we start to talk about things like prostate cancer. And some of the symptoms are quite classic for prostate cancer. Your father, your grandma, your grandfather, even yourself may start to experience things like suddenly you are having difficulties passing urine. You go to the toilet and you really struggle to empty your bladder. Even when you've emptied your bladder, it still feels as if there is urine that is left. Some of these very subtle things could be the early warning signs that you could actually have something like prostate cancer. For the leukemias that I mentioned, the blood cancers, a patient might present with chronic anemia. You've been going to the clinic and they are telling you that your blood levels are low, your blood levels are low. But the real cause of why your blood levels keep going low has not been established. So anyone who comes in with low blood levels, some of the things we look for is, does this person have a blood cancer, a leukemia? So really, the symptoms that someone with a cancer presents with depends on where the cancer is. If I have a brain tumor, for example, I may begin to experience headaches. If I have a cancer affecting my kidneys, I may begin to experience pain on my side. If I have a skin cancer, I may develop an ulcer on my skin. So that's just a break in the skin that keeps growing and doesn't really respond to usual treatment. So the symptoms depend on where the cancer is. But then there are also some things that are common to most cancers. Someone might find themselves beginning to lose weight, even when they're not actually trying to lose weight. The person with the cancer might begin to notice that they sweat a lot at night. They may lose their appetite. They may feel generally tired. These are what we call constitutional symptoms. They're common to most cancers. So in addition to asking you questions about specifically where we think the cancer might be, we would ask you about some of these other really not very specific, but still very useful symptoms. So what should you do if you think that you or a loved one might have a cancer? Can we actually find out? The answer is yes. Cancers can be diagnosed. And the earlier a cancer is diagnosed, the better. So this is why it's important to use platforms like our Message Zambia app to be able to find your nearest health service provider, so that you're going to the hospital, to the clinic, not just when you're feeling unwell, but as part of routine day-to-day. When you have an annual medical checkup, for example, it's much easier for your doctor to see if there is something new that wasn't there last year, and then they can start looking for the cause of that more aggressively. So using platforms like the Message Zambia app, visiting your nearest health facility will allow you to be screened for the many different cancers that we know are common in our setting, especially things like cervical cancer, prostate cancer, breast cancer, and the blood cancers I talked about. So what do we then do? How do we actually make a diagnosis? So the first part is your doctor, such as myself, will have a nice long chat with you, asking you a lot of different questions, trying to find out, is there something that possibly is putting you at higher risk? So you might ask, are there things that can put me at higher risk for certain types of cancers? And the answer is yes. We know very clearly that there are certain things that increase the risk of you developing different types of cancers. For example, to have prostate cancer, you must have a prostate, so you have to be a male. To have cervical cancer, you have to have a cervix, so you have to be a female. But other than being male or female, there are other things that can potentially increase your risk of developing certain cancers. Let's take lung cancer, for example. Lung cancer is one of those cancers that has been directly linked to a specific activity, in this case, the use of tobacco. And this is the use of any tobacco, whether you smoke it, whether you chew it as snuff, whether you inhale it as snuff, whether you use it in whatever ways that we're now consuming tobacco, things like shisha, those still contain toxins from tobacco. So anything that introduces tobacco and the carcinogens, the things that cause cancer into your body, can increase your risk of developing lung cancer down the line. Other things, such as the excessive use of alcohol, can potentially lead to liver cancer, for example. There are also certain infections that we know increase your risk of developing cancer down the line. For example, if someone has what we call hepatitis, specifically hepatitis B or hepatitis C, having either one of those two diseases significantly increases your risk of developing liver cancer down the road. For women of reproductive age, we know that there are certain viruses that have been associated with the later development of cervical cancer. So human papillomavirus has been known to be directly linked to the development of cervical cancer. And that is why when you talk about prevention, there are things that we therefore can do. So if I know that smoking increases my risk of developing lung cancer, then the best thing for me to do is to not smoke. Since we know that having an infection like hepatitis B or hepatitis C increases my risk of developing liver cancer down the line, then I would need to protect myself against contracting hepatitis B or hepatitis C. And we can do this in multiple ways. We can vaccinate you against hepatitis B if you are a high-risk person. So, before we continue, we'll go on a short break. But again, this is MedSearch Zambia Live. We're talking about cervical cancer and other cancers and how you can use our app, the MedSearch Zambia app, to help you find information and services around cancers.
Pharmacy, a clinic, a laboratory, or even a hospital in Zambia, and you'd love to increase your visibility out there? Well, there's a simple application for you. It's called MedSearch Zambia. MedSearch Zambia is a medical directory app that allows or gives your business the widest visibility out there for those new and more customers. So you can simply subscribe to MedSearch Zambia, or you can simply call the number on the screen, and let's do business the easy way.
Welcome back. My name is Dr. Mataa, co-founder of MedSearch Zambia, medical provider. Today on MedSearch Zambia Live, we are talking about cancers. What are they? How do they present? And what should we do when we think that we might have a cancer? Before we broke off, we were talking about some of the things that we could do to potentially protect yourself from getting a cancer. So we talked about not smoking, we talked about avoiding excessive use of alcohol, we talked about getting necessary vaccinations. In addition to that, for certain cancers, other than hepatitis vaccinations, for example, knowing that cervical cancer is a very common cancer in Zambia, there is actually a program to vaccinate young girls and women of the reproductive age against human papillomavirus. So for those types of cancers where we know that there is a cause, removing that cause could potentially eliminate or at least significantly reduce your risk of getting that type of cancer. Now, I'm not saying that if I do not smoke, I cannot get lung cancer. Unfortunately, that is not the case. It will reduce your risk, but it does not eliminate it completely. And this is true for all the other measures that someone can employ. I think the real take home would be that living a healthy lifestyle, including moderate exercise into your day-to-day life, watching what you eat, avoiding a sedentary lifestyle. These are things that we know improve your general well-being. They improve your heart health, they improve your brain health, and long-term have been shown to reduce the risk of developing a lot of lifestyle and other conditions such as cancers. But even in that setting, it is still possible to develop cancer. So what, if anything, can we do? So this is where early detection really comes into its own. It's very important that we look for these things early. And we'll talk about the treatment of cancer in a few minutes. But the first thing is we must find it early. And there are ways we can do this. I spoke earlier about making routine healthcare as part of your regular program. Using the Message Zambia app will let you find your nearest health service provider who will perform an annual medical on you. And if we catch most cancers early, it improves your chances of a successful treatment. So for example, we spoke a little bit about breast cancer in women, and it's one of the things that every woman should be doing. Self-breast examination on a, if not daily, but at least weekly to monthly basis will let you catch a lump in your breast early and then prompt you to go and visit your healthcare provider to have it further assessed. For things like cervical cancer, visiting your nearest health service provider, most government clinics do actually provide cervical cancer screening where they will check and see if you have any early signs of cervical cancer, and then they would put you on a program of follow-up. The same applies for us men. As we get older, we do need to think about having ourselves checked for our prostates. So visiting your nearest urologist who is specialized in assessing and checking for the presence of early signs of prostate cancer. So screening is very, very important because it allows us to give you the all clear if there is nothing wrong, but it also allows us to catch those who do have cancer early, which increases our chances of successful treatment if they do develop cancer. So what if you come to the hospital, you come to the clinic, and we actually do make a diagnosis of cancer? Is there anything we can do about it? The answer is yes. There is always something we can do about it. The only thing that varies is, are we going to cure it, treat it, or perform what we call palliative care? So early diagnosis improves our chances of successfully treating it, and there are different treatment methods that we use when we talk about cancers. Some of us may have heard of things like chemotherapy. Chemotherapy are essentially medicines that we give that target specifically cancer cells, cells that have been growing rapidly and abnormally, with the aim of killing them and removing them so that they do not continue growing. Different types of cancers respond differently to different chemotherapy medications, and your doctor, your oncologist in this case, would be able to advise you in terms of what cancer you have and how it is best treated. In addition to medicines, for certain cancers, we might need to perform surgery. So for example, someone has a prostate cancer, a breast cancer, a cancer that is in a place that is accessible for surgery. Sometimes by removing it through surgery, we can actually stop the spread of the cancer. Now remember, we started off by saying that the problem with cancer is that your cells are growing abnormally and they also spread to other parts of the body. So if we catch it early and it's in a site that we can access through surgery, then that is a great option. But if it has already spread, we can still perform surgery, but then it would have to be in addition to chemotherapy, which we've already talked about. And then there are other things like radiotherapy. Radiotherapy really is just identifying where the cancer is and then directing radiation waves to essentially burn it out. We're trying to kill the abnormally growing cells and allow the body to regenerate its own normal cells. So these are some of the treatment options that are available. So it's surgery, it's chemotherapy, it's radiotherapy. Obviously, each of these has its own risks and its own complications. And this is why early diagnosis is very, very important. The sooner we catch a cancer, the more likely we are to treat it successfully, and also possibly the less amount of chemotherapy drugs you might need to be exposed to, the less amount of radiotherapy you might need to be exposed to, and potentially also the less drastic the surgical intervention might need to be if the type of cancer that someone has is one that can actually be treated with surgery. So all of these are part of a treatment package, and these can be offered to you at your hospital, at the Cancer Disease Hospital, for example, and you can use the Mataa Zambia app to find services and service providers that would be able to offer these types of services. So that's treatment. So the question then is, what if my cancer cannot be treated? Is there anything that can be done? So the answer is yes. Unfortunately, not all cancers can be treated, or even those that can be treated. Sometimes patients may present to health facilities quite late, once the disease has already progressed quite far. If I had a breast cancer and now it has spread to my lungs, it has spread to my brain, it has spread to other parts of my body, performing surgery in that case would not take away the cancer. Taking chemotherapy would not cure the cancer. Performing radiotherapy may not cure the cancer. We would still perform all of these treatment modalities, obviously in discussion with you as the patient and with your family to reach a decision in terms of what is the best option for me at this point. At the same time, we do need to think about the non-medical part of cancer treatment. It's not just about chemotherapy, it's not just about radiotherapy or surgery. We have to think about you as a person. Cancer presents a lot of different complications, and we will talk about these very shortly. So the takeaway from this part is making a diagnosis early is very, very important. If you are unwell, visit your nearest healthcare provider.
Hi, do you own a pharmacy, a clinic, a laboratory, or even a hospital in Zambia, and you'd love to increase your visibility out there? Well, there's a simple application for you. It's called MedSage Zambia. MedSage Zambia is a medical directory app that allows or gives your business the widest visibility out there for those new and more customers. So you can simply subscribe to MedSage Zambia, or you can simply call the number on the screen and let's do business the easy way.
So we've spent some time talking about cancers and what some of the most common ones are, some of the things that we should be looking out for. And I want all of you to know that the main thing we want you to know is that there is information out there, and that's where the MedSage Zambia application comes in. Our application allows you to find your nearest healthcare provider so that you are able to get accurate and correct information close to your fingertips. And the earlier we make a diagnosis, the better the options are for someone who has cancer. So our MedSage Zambia application allows you, in the comfort of your home, in the comfort of your office, to find service providers near you that would be able to answer some of the questions you might have. They will tell you where to go and be screened for cervical cancer. They will tell you where to go and be screened for prostate cancer. You're able to use our application, the MedSage Zambia app, to find service providers. For those of you who may already be undergoing treatment for cancer, the application allows you to find service providers that may be offering things like pharmacy services for you to access some of the medications that you're currently on. Services such as rehabilitation services, physiotherapy, massage therapy. All of these services can be found by downloading the MedSage Zambia app. It's free to download on both Android and iOS devices. It's easy to use, and it's meant to help simplify healthcare. Thank you for tuning in to this month's MedSage Zambia Live. My name is Dr. Mataa, co-founder of MedSage Zambia. This month we were talking about cancers and how you can use the MedSage Zambia app to help you find information and service providers that will be able to provide services related to cancer. Our MedSage Zambia app will help simplify your healthcare. It's going to make you find service providers that are going to tell you where you need to go and what kind of services they're able to provide to you as you think about and look for services related to cancer.